This is my Swaziland update for Swaziland and AIDS Cure. The lag time for my AIDS exposure test is roughly about a few seconds from the time you're infected. Okay, where if you use the rapid blood test, it is 20 to 40 minutes long, and it is 3 to 4 weeks lag time. What I'm trying to say is my exposure test in countries in Southern Africa where there's a high incidence rates among HSV patients of HIV and a subsequently high infection rate of co-infection of HIV and HSV, that you can use this groin sores or hemorrhoids test or even mouth sore test to determine whether the person has a high risk of having AIDS or HIV. The result of that is that you can go and just simply look at somebody. In a few seconds, you'll know, well, I've been exposed to HIV. I should go get PEP treatment. PEP treatment, if administered or started within 48 hours, it's a 4-week total treatment, has something like an 80 to 90% effectiveness rate. But it's almost 100% effective if taken less than 48 hours, and you lose about 25% of the patients after between 48 and 72 hours. And after 72 hours, it's almost useless. It's these lag times that's so important. The rapid AIDS test that we currently utilize, it's a blood test, takes about 2 to 4 weeks lag time from the time you catch the HIV virus to the time it shows positive. Whereas my AIDS exposure test only takes seconds to tell you whether you may have been exposed. It's not perfect. There's 20-something% that won't have HIV. There's about 2% that will have HIV and not show it. But there's 77% that'll show it and have HIV in those Southern African countries. So they should be really important to them to watch out for that. Most of the rest of the world doesn't have enough HSV victims infected with HIV to matter. But in them Southern African countries, watch out for HSV or groin sores. That's lesions or stuff of that nature in the groin. It's very important that you watch out for that. And if you do come into contact with that kind of a person, you don't have AIDS already, and you don't test positive for AIDS when you go in the emergency room, then take PEP treatment. The PEP treatment will keep you from catching the disease. Well, Thomas Willis out here. Have a good one.